Biomedical Image Processing course. In this module, we will see inflammation and endothelial dysfunction is the another type of symptoms which are associated with retinopathy. Retinal vascular changes in diabetes, hypertension and other systemic disease processes may be related to inflammation and or endothelial dysfunction. Details about these are shown in table 7.3. In this table, it is shown that retinal vascular changes and the marker of subclinical diseases which are associated with diabetic retinopathy and has been found during this study which has been done by various researchers. This concept is supported by data from 3 population-based studies in which various inflammatory markers were demonstrated to be associated with larger retinal venules. In the Wave damp eye study, indicators of endothelial dysfunction were also shown to be associated with larger retinal venular caliber. In the study of this dysfunction, these observations agree with finding from experimental studies which demonstrated an increase in diameter of retinal venules but not arterioles after administration of lipid hydroperoxide into the vitreous of rats with resultant increase in number of leukocytes in the retinal microvasculature. Dilation of retinal venules have been postulated to be a result of increased production of nitric oxide secondary to release of inflammatory mediators which are one of the cause to develop the retinopathy. The collective data from these studies suggest that both inflammation and endothelial dysfunction may place key mechanism role in interlinking retinal venular dilation with systemic diseases. Subclinical cardiac morphology we will see in these successive slides of this module. Prospective data from the ARIC study indicate that retinopathy may predict clinical CHD and congestive heart failure events in the general population. Subclinical cardiac morphology, in that now evidence of retinal vascular changes may be associated with early geometric alteration in the heart prior to manifestation of clinical heart disease. Details about that shown in table 7.3. Previous studies have demonstrated strong correlation of retinopathy grades with left ventricular hypertrophy LVH in persons with hypertension. In the ARIC study, both focal and generalized narrowing of retinal arterioles were associated with increased odds of LVH in middle-aged African Americans independent of blood pressure and other risk factors. This is supported by recent analysis of the cross-sectional data from the MESA showing that in the general population, narrower retinal arteriolar caliber is associated with left ventricular concentric remodeling. Determined from cardiac MRI even after adjusting for traditional risk factors, odd ratio, 1.87, 95% confidence, interval 1.41 to 2.48. This association remained significant in those without diabetics, hypertension or significant coronary calcification, but was strongest in diabetic person. Odds ratio 4.02, 95% confidence, intervals 2.05 to 7.88. Therefore, narrowing of retinal arterioles may be a marker of early subclinical myocardial abnormalities. Now we will focus on genetic association of retinal vascular changes. The efforts and effect of genetic and environmental factors are intertwined in the development of cardiovascular diseases. However, the genetic influence on the microvascular is unclear. Utilizing new retinal image analysis technology, emerging studies have begun exploring these important aspects. For example, the Beaver damp eye study reported that retinal vascular calibers were more highly correlated between relatives than between unrelated individuals, and observation proposed to be due to shared genes. This is in keeping with data from a recent twin study showing that 70% of the variance in retinal arteriolar caliber and 83% of the variance in retinal venular caliber were contributable to genetic factors. Newer data from the Bayer damp eye study, which is based on genome-wide linkage scan, further reinforce the genetic contribution to the variation in retinal vascular calibers, independent of hypertension and other confounders which might be found along with the diabetic retinopathy. The investigators shows that the linkage region for retinal vascular caliber overlap with regions that have been previously associated with essential hypertension, coronary heart disease, endothelial dysfunction and vasculogenesis. These novel findings provide the first genetic evidence to support the clinical observations as described that changes in retinal arteriolar and venular caliber may precede and contribute to the pathogenesis of cardiovascular disease. Genetic association of retinal vascular changes, in that while the currently available data regarding the genetic basis of retinal vascular changes are limited, findings from recent studies clearly demonstrate the usefulness of retinal image analysis in advancing our understanding of the complex genetic environmental interaction pathways involved in the pathogenesis of cardiovascular disease. The existing prospect of this expanding field of research opened many possibilities for the researcher. There is increasing recognition that retinal vascular image analysis present great potential to advance our understanding of the role of microvascular disease in the development of various systemic disorders. Retinal vascular changes have now been linked to a spectrum of clinical and subclinical subclinical cardiovascular and metabolic outcomes. With this, it seems that it has more complex process while going to make the grading for retinopathy. The mounting evidence generated from recent studies supports the notion that the retinal vasculature may provide a lifetime summary measures of genetic and environmental exposure and may therefore act as a valuable risk marker for further systemic diseases. Nonetheless, despite an increasing application of retinal image analysis in research settings, its clinical value remains to be determined. Epidemiological evidence that retinal vascular changes are significantly predictive of morbid events does not necessarily translate directly into clinical practice. Further, research is clearly required, perhaps with a more directed focus in assessing the ability of retinal imaging to provide clinically useful information above and beyond currently available risk stratification methods to aid prevention and management of cardiovascular and metabolic diseases which are associated with retinal diseases. Finally, there remain additional novel measures of retinal vascular structure that may offer additive value to the existing traditional retinal vascular sign. In predicting systemic diseases, the role of these new measures in retinal image analysis remains to be clarified. Now we will see the next topic, segmentation of retinal vascular using wavelet and supervised classification. In that we will go for theory as well as its implementation. Let us see the background introduction of this technique. Inspection of the topic fundus vasculature can reveal sign of hypertension, diabetics, arteriosclerosis, cardiovascular diseases and stroke which might be suffered by the subject. Retinal vessel segmentation is a primary step towards automated analysis of the retina for detection of anomalies and image registration. Automated assessment of the retinal vasculature morphology can be used as part of a screening tool for early detection of diabetic retinopathy. While retinal image registration is of interest in detecting retinal changes, mosaic synthesis and real-time tracking and spatial referencing for assistance in laser surgeries. Different techniques are used for acquiring retinal images. Most common are colored or monochromatic photography and angiography using fluorescent dye added in the blood of the subject. In monochromatic photograph, color filters are used to select light wavelength that enhance the visibility of various fundus structures. Lighting using wavelength close to the green region of the spectrum known as red-free lighting is frequently employed as it leaves vessels, hemorrhages and exudates more apparent. Angiographies, on the other hand, requires the injection of a small amount of fluorescent dye into the patient, usually sodium fluorescent or indocyanine green. Fluorescent angiography permits recording of blood vessels and flow and also the detection of eventual leakages of interest for diagnostic purposes. However, it is inadequate for screening programs as angiograms can only be obtained by specialists in the ophthalmology clinics and is invasive, presenting a certain risk of side effects to the patient. In face of the different forms of image acquisition, it is desirable that segmentation method be able to work on images from different modalities. And in this case, as an additional difficulty, even images of the same modality present large variability depending on the patient, presence of pathology, camera model, illumination and focus adjustment. These are certain constraints which we have to follow while acquiring the images. Images with strong illumination, variation or deficiency, light reflexes from the cornea and inadequate focus are common and depending on the application at hand must be treated appropriately, posing an additional challenge in the development of segmentation methods. The retinal vasculature is comprised of two complex networks, one of veins and the other of arteries that spread out from the optic disc and branch successively to occupy different regions of the fundus. Retinal blood vessels are locally continuous with respect to position, curvature and width, with vessel width gradually decreasing with distance from optic disc. These properties are specially important during the design of tracking algorithm. Additionally, vessels are defined by a pair of parallel borders in which the image derivative presents opposite sign in such a manner that the shape of vessel cross-section can be locally approximated by Gaussian functions. These properties provide for vessel models that are usually as valid for retinal photographs as for angiograms, with vessel appearing as lighter than the background in angiogram and darker in colored and red-free photographs. So according to as color model change, the different lesions can be highlighted. Diabetic retinopathy screening involve assessment of optic fundus with attention to a series of indicative features. Of great importance is the detection of changes in blood vessel structure and flow due to either vessel narrowing, complete occlusion or neovascularization. Now, neovascularization is a condition associated with proliferative diabetic retinopathy, an advanced stage of the disease in which new vessels are formed emerging from the area of the optic disc or from peripheral vessels. Prior to neovascularization, it is common to note vessels narrowing or dilation and increases in tortuosity. These changes can be detected by morphological analysis techniques through quantitative measures such as vessel width and length, tortuosity and fractal dimension. Another major application of retinal vessel segmentation is registration of images captured at various instant of time or under different angle. As we change field of view, it will give various lesions, branching and crossing points or skeletonized vasculature may be used as spatial landmark that provide for registration of images even from different modalities. Temporal registration assists in the detection of diseases and assessing effects of treatment. It may also be used for analysis of blood flow in angiographic video sequences as the fluorescent dye reaches the optic fundus and retinal vessels. Partial view of the retina taken at different angles can also be combined to synthesize retinal mosaic. The mosaic can then be used for taking accurate morphological measurements or planning and assistance during laser surgeries through real-time tracking and spatial referencing. Finally, registration of images from different modalities allows visualizing superposition of clinically important elements that previously appeared separately. The retinal and choroidal vessels structures are used in biometrics for identification or verification and authentication of a person in security system. Among many possible biometric features used, the optic fundus vascular pattern possesses possibly the lower error rate besides being very stable through time and particularly impossible to counter thereafter. However, its use has limited reach due to high cost and a slight discomfort to the user during image acquisition process. These disadvantages could possibly be surpassed, but with variety of available biometrics, it is hard to predict the future of this particular application. Now let us summarize this module. We have started with inflammation and endothelial dysfunction. Then we touched to subclinical cardiac morphology, genetic association of retinal vascular changes, segmentation of retinal vasculature using wavelet, and supervised classification. We have also seen theory and implication with their background of the techniques. Now in next successive module, we will try to cover current topic will be remain continue along with various types of transformation which are required for detecting them. These are few references which we have used to form this module. Thank you very much.